The number of Ontario ER closures has soared to a new record, with this new report released by the Ontario Health Coalition painting a stark picture about the future of healthcare in Ontario. Because healthcare in Ontario is no longer collapsing, we are in collapse. In 2023, we've seen 868 temporary or permanent ER closures. We've also seen 316 urgent care center closures, 2 outpatient laboratory closures, 11 obstetrics units closures, 1 ICU closure, and 1 labor and delivery unit closure. This means we've seen approximately 1,200 closures this year, totaling 31,000 hours. This means that in Ontario this year alone, we have lost about 3.5 years of healthcare. And the list of closures is constantly growing. And we know why these closures are happening. It's because of wage suppression legislation. It's because of the privatization of staffing through for-profit staffing agencies. It's because of the government's decision to end emergency COVID funding. It's because of the extremely short-term funding agreements that were announced after short staffing had become critical. This government has no long-term plan other than to let it fail and hope the free market can fill in the gaps. And the long-term underfunding of healthcare by previous Liberal and Conservative governments has meant that Ontario had no surge capacity left at the beginning of the pandemic. We have the fewest hospital beds per person out of anywhere in the country, and we are funding hospitals at the lowest rate in the country. Doug Ford has been telling us for over 6 years now that he was going to end hallway medicine, but it has only gotten worse. And we have actual numbers to show this. This year alone, Ontario only increased healthcare funding by 0.5%, even when inflation was 5.65%, meaning that there was a massive real dollar cut of over 5% to our healthcare budget. We need to keep talking about this. We cannot let Ford get away with this. So keep your eyes on the Ontario Health Coalition because they will keep you up to date on this.